Unfortunately, over the course of my career as a physical therapist, I have heard over and over again the story. I used to run and I loved doing so, but I quit because I was afraid running was going to damage my joints. In this video, I'm going to discuss the following topics. Do runners have more age-related joint damage than non-runners? Is there an optimal weekly running mileage for joint health? What areas of cartilage in the knee might actually benefit from running? What areas of cartilage in the knee can running be hard on? What can you do to reduce stress to your knees when you run? And how should you approach running if you have knee arthritis or a meniscus tear? Is running really so bad for you that if you do it year after year, it's going to wear away at the cartilage in your joints? Is there evidence for this? Let's look at some of the evidence that puts this common misconception in question. This large study looked at the prevalence rates of hip and knee arthritis in a group of over 100,000 individuals to see if recreational runners do in fact develop osteoarthritis at a greater rate than non-runners. What they found was that only 3.5% of recreational runners in this group had hip or knee arthritis. What about non-runners? The prevalence of arthritis in non-runners was actually 10.2%. This means that the runners in this group were developing arthritis at a rate of 1/3 that of non-runners. What about overall mileage? Does the amount of miles you run year after year have any effect on your risks for developing hip and knee osteoarthritis? In the same study of over 100,000 individuals, it was observed that runners classified as elite runners actually developed hip and knee osteoarthritis at a rate of 13%, compared to non-runners who only developed arthritis in these areas at a rate of 10%. There are several studies that suggest there is a happy medium when it comes to running mileage and joint health. Don't do enough and you have increased risk for seeing more age-related wear and tear in your joints, or do too much and you see the same thing. Let's review some of the evidence for this. Another study looked at a group of 27 prior highly competitive runners in their 20s and 30s who remained active running at a recreational level later in their running careers. This group ran on average between 12 to 24 miles a week consistently over a median of 40 years. What they found when they compared this group of prior competitive runners to a group of non-runners was that there was no increase in arthritis in the hips, knees, and ankles seen in these more competitive runners. This study suggests that there may be an optimal dosage of running that keeps your joints healthy over the years. Is there evidence that running too many miles over several years might actually put you at risk for wearing your joints out faster? If running is good for your joints, can too much of a good thing become a bad thing? Another study looked at how the joints of runners changed over a period of 15 years using X-ray studies. What they found was that faster running paces and higher mileage of greater than 60 miles a week were predictive of the development of arthritis at the hip joint in runners. This study suggests that there may very well be an upper limit to the mileage and intensity of running that is actually protective and beneficial to joint health. This next study actually took a group of runners who were training for a marathon, took an MRI of their knees pre-training and post-training to look for signs of wearing away of the cartilage in the knees of these runners as a result of training. What they found in most of these runners pre-marathon training is that most of them actually already were showing signs of age-related cartilage changes in their knees, even though they weren't symptomatic. What did the MRI show post-marathon training in this group of runners? Actually, what they found was quite interesting. Some areas in the knee actually showed signs of improved cartilage health, and then other parts of the knee where it seemed to get a little bit worse. Where exactly were these different areas in the knee that got better and areas that got worse? The areas that actually showed signs of improved cartilage and joint health were between the tibia, the shin bone, and the femur, the thigh bone. So improved cartilage health was noted overall in most participants in the tibiofemoral joint, which is really the main weight-bearing joint of the knee. The area where there were signs that cartilage health might have been a little worse post-marathon training was actually right around the patellofemoral joint. So that's the surface between where the kneecap, the patella, meets the femur, the thigh bone. So what does this mean? What's the difference between having arthritis at your tibiofemoral joint versus your patellofemoral joint?
I think one of the biggest concerns that people have about running is that it's going to lead to bone-on-bone changes in their joints over the years. People usually associate this with needing to have a joint replacement. What part of the knee actually gets replaced when you have a joint replacement procedure? These procedures are done in people who show significant progressive damage and cartilage loss, not at their patellofemoral joint, but at the tibiofemoral joint, which is the part of the knee that actually showed signs of improved cartilage health post-marathon training in this particular study.
So if running is actually bad for your joints, why in this group of marathon runners did the MRI show actual reversal of cartilage damage at the tibiofemoral joint? Could it be that activities such as running might actually be good for the health of your joints?
Looking at the evidence so far, this seems to be a definite possibility. Let's discuss a little bit about cartilage to try and make some sense of this. It's important to know that cartilage is avascular, meaning it does not have its own blood supply. The cells in cartilage rely entirely on compression and release at the joint surfaces during weight bearing to get their nutrition in and waste products out. Running is just one example of a great activity that can help promote this compression and release to help with fluid flow into and out of the cartilage cells. Just like you can train muscles to be stronger with strength training, you can also improve cartilage health with the right types of exercises done in the right amounts.
So what about this patellofemoral joint? It's no secret that runner's knee is the most common injury that a runner's going to get in their training. Runner's knee is actually an injury to this patellofemoral joint. This is a basket term for pain in and around the kneecap area. The good thing that runners can take comfort in knowing, however, is that patellofemoral joint arthritis isn't the type of arthritis that's going to land you a joint replacement. The good news also is that runner's knee can be really easy to stay on top of when you incorporate the right types of strength exercises into your weekly workouts and when you follow a smart, well-structured running plan.
If you're concerned about running being bad for your knees, you need to get on a good 6 to 8 week strength program done twice a week prior to bumping up your mileage for a big upcoming race, and then at least once a week while bumping your mileage in preparation for this race. This program should focus on strengthening the hip and thigh muscles. For a runner's knee, there's very solid research that supports the benefits of strengthening these areas for reducing knee pain.
These same tips hold true for runners who have known arthritis and meniscus damage in their knees that's known to cause swelling with increased activity levels.
If this is you and you know that activities like running tend to flare your symptoms or make your knee swell the next day, it's super important that you listen to these symptoms. Don't actively go out on a hard run if you have a lot of swelling in your knee. Save your running for after symptoms have settled, and when you start back up, make sure that you progress things very slowly. You may consider doing run-walk intervals when you do your next run. You may also consider reducing the frequency of the amount of running you do each week. making sure that you take at least 1 to 2 days off between your runs. Just make sure that you're doing things slowly and gradually. You can build mileage and intensity, you just might need to do this slower than others. You need to be also very proactive about listening to your symptoms, especially when there's swelling in your knee. Running shouldn't make your knee swell up like a grapefruit. This is usually a dead giveaway that the joint is unhappy with what you're doing.
In addition to taking things slowly, it's absolutely critical that runners who struggle with knee swelling incorporate strength training into their weeks on a very regular basis. The areas to target are the same as for runner's knee. Keep your thigh and hip muscles strong in the weight room, in addition to following a smart, gradual building run program, and your joints will be much happier and healthier.
So what's the moral of the story? Running done in the right amount, not too little and not too much, might actually be good for the long-term health of your joints.
If this video was helpful to you, please make sure to subscribe to my channel so you can see more videos like it. If you have a friend or know of anyone that struggles with knee pain and swelling when they run, make sure to share this video. Thanks for watching.